Hey guys, Dr. Greg Rose here from TPI. One of the most asked questions we get on our YouTube channel is, what mobility exercise should I do for that problem that you highlighted? Well, it's not that easy, and I want to explain real quick. What's really important is that you use the right tool for the right problem, right? And mobility problems come in three forms. In other words, there's three major ways that you can lose mobility. The first way is a mechanical cause. In other words, maybe your joint is restricted, or maybe the tissue, like your fascia, or your ligaments, or your tendons are tight. So those are the most common, are these mechanical restrictions. But I do want you to know there are two other big categories of mobility restrictions. There are chemical causes. You know, this is kind of like if you go do a big heavy workout, the next day you feel a little sore, that's because you created inflammation. Inflammation can actually reduce mobility, right? This is a lot of times like, hey, I get on a treadmill and I run, it loosens up. Well, you're getting circulation going, right? That's the other form of chemical restrictions, ischemia, lack of blood flow, right? So if you sit for long periods of time, believe it or not, your lower extremities become less mobile because you're restricting blood flow. So inflammation or lack of blood flow are very common chemical causes, different exercise to attack those. There's a third category of mobility problems called neurological problems. These are, you really don't have a mobility problem, but your brain is kind of guarding the area. You know, if you've ever had a previous injury, a lot of times the brain can shut down the range of motion just to protect you. Now, you have a mobility problem, but it's not because the joint's restricted, it's because there's a guarding or what we call a neurological problem. So the first thing is figure out which of your mobility problems is which category. Is it a mechanical cause? Is it a chemical cause or a neurological? Let me give you an example of probably the most common, and that's a joint restriction. That's a mechanical cause. So for example, if you've got a joint restriction in your hips, let me show you one of my favorite exercises. So what I like to do is I'm gonna lay down. Now, anytime a joint is restricted, first of all, there's a couple signs that it's joint. Like, how do I know it's joint versus neurological or chemical? Normally, a joint is what I call an equal opportunity employer. It's restricted in multiple planes. In other words, it's hard to flex, it's hard to extend, it's hard to internally rotate, externally rotate. So if you notice, hey, this one joint, it just doesn't like to move, or my hip doesn't like to move in any direction, it's probably a joint, right? That's the most common. The other sign is that if I flex my elbow, and let's say my elbow doesn't want to flex, if you feel the restriction on the contractile side versus the elongating side, it's usually a joint. So in other words, if I feel something stuck here in the front, it's probably a joint. If I feel something pulling over here, it's probably more tissue, right? So let's say you've got a hip joint problem. My favorite way to attack hip joint mobility is with distraction. And this applies to any joint restriction. I like doing distraction exercises. So for example, let's say your left hip is restricted. Now, this is an exercise for internal and external rotation. This is called a hip windshield wiper. If you just take your foot and you just go back and forth, to me that looks like I'm working on internal and external rotation. Honestly, I feel like this doesn't do anything because you're not doing the distraction of the joint. If I take this and instead I understand that this is a joint restriction and I need to distract the joint, and I do this. I take my heel and I push my heel away from me. I feel like I'm trying to dislocate my hip from the socket. It's almost like somebody was pulling my leg, and now I start to internally rotate. You'll feel a very different exercise here. So I take my heel, I try and drag my heel as far away from me as possible. You don't have to go really wide, somewhere comfortable. Drive your heel away, and now as you're driving it away, try and internally and externally rotate. Each time you do this, try and get your foot to go farther away from you. I always say, imagine I'm trying to unscrew my hip from the socket. I'll do 30 seconds with each leg, right? And I'm telling you, some of you will feel some big cramping just doing this. It's very different than without the distraction. Then I take my hands over here, change the angle of my pelvis, and I rinse, repeat. I do the same thing. I do 30 seconds trying to drive my heel away, going back and forth. I'll even do two other positions. I'll do what I call the hurdle position here. Try and distract, and try and go as far as you can. 30 seconds, I'll do a crossover, same thing, try and distract. All of this just changes the orientation of the hip joint while you're trying to distract the joint. If you did that on your left, of course you would repeat on the right, and imagine if you did that every day. I'm telling you, your joint restrictions will be a thing of the past. Those are some of my favorite ways to attack mobility problems. First and foremost, make sure you're attacking the right problem with the right tool.